I have been a licensed veterinarian for over 12 years. In that time, I have watched thousands of cats die from kidney disease, and I need to tell you something that no one in my profession is supposed to say out loud. Most of those deaths were preventable, not with medication, not with a $1,000 treatment plan, not with a prescription diet that costs $80 a bag, with a $2 ingredient that has been sitting in peer-reviewed literature since 1987, an ingredient the pet food industry has spent decades making sure you associate with something else entirely. I am not exaggerating. I am not selling you anything. I am telling you this because I watched a 12-year-old cat named Luna die of kidney failure 6 months ago in my clinic. Her owner had done everything right. Every vet visit, every recommended food, every supplement we prescribed. She still died, and she did not have to. Stay with me, because what I am about to show you is going to change how you think about every bowl of food you put down for your cat. To understand why your cat's kidneys are in danger right now, even if your cat seems perfectly healthy, you need to understand what cats actually are. Cats are obligate carnivores. That is not a preference. It is biology. Their entire metabolic system evolved over 10,000 years in desert environments. Their bodies are specifically designed to extract water from prey. A mouse is approximately 70% water. A bird is 65% water. Cats evolved with a low thirst drive because they were never supposed to need a water bowl. Their kidneys are extraordinarily efficient at concentrating urine, a survival mechanism for animals living in environments where standing water was scarce. That biological adaptation is now killing them, because in 1956, the Ralston Purina Company launched the first mass-market dry cat food in history. It was not developed by veterinarians or animal nutritionists. It was developed by food engineers, applying the same extrusion technology used to manufacture breakfast cereal. The goal was not feline health. The goal was a shelf-stable product with a 5-year shelf life that required no refrigeration and could be manufactured at scale for pennies. Dry kibble contains between 6 and 10% moisture. Your cat's natural prey contains 65 to 70% moisture. You are feeding a desert animal, one that evolved to never drink water, food that contains 1/10 the hydration their biology requires. And you are doing it 3 times a day, every day, for their entire life. The result of chronic low-grade dehydration in cats is predictable and well documented. The kidneys are the first organ to suffer. When a cat does not consume adequate moisture, the kidneys must work continuously at maximum concentration capacity to filter metabolic waste. Over years, and in some cats over just months, the nephrons inside the kidney begin to scar and die. Kidney function drops. Toxins accumulate in the bloodstream. By the time a cat shows visible symptoms of kidney disease, weight loss, vomiting, drinking excessively, they have already lost between 65 and 75% of functional kidney tissue. That is not a disease that crept up without warning. That is a disease that was built, meal by meal, bowl by bowl, over an entire lifetime. In 1987, a researcher named Dr. Delmar Finco at the University of Georgia published findings that should have changed feline nutrition permanently. His study demonstrated a direct causal relationship between dietary phosphorus load and the rate of kidney deterioration in cats. High phosphorus foods, which includes virtually every dry commercial cat food on the market, accelerated kidney decline measurably in every test subject. The study was not ignored by accident. It was published in the American Journal of Veterinary Research. It was peer-reviewed. It was replicated. The pet food industry read it, and then they continued manufacturing the same high-phosphorus dry food formulas they had always made, because changing the formula would increase production costs. And increased production costs reduce the margin on a product generating billions of dollars annually. In 2006, a landmark study in the Journal of Veterinary Internal Medicine confirmed what Finco found, and went further. Cats fed a high-moisture, low-phosphorus diet showed measurably slower kidney disease progression compared to cats fed standard dry food. The researchers were not talking about expensive prescription diets. They were talking about the moisture content of food. Water, the single most critical nutrient for feline kidney function. Freely available, impossible to patent, impossible to brand, impossible to sell at $40 a bag. Here is the specific mechanism they found. And this is the part the industry does not want in mainstream circulation. Phosphorus, when consumed in excess, is directly nephrotoxic in cats. It damages kidney tubule cells on contact. In a healthy kidney with full function, the damage is manageable. In a kidney that has already lost 30 or 40% of its nephrons, which can happen silently, with no symptoms, excessive dietary phosphorus accelerates scarring at a rate that becomes irreversible within months. Standard dry cat kibble contains phosphorus concentrations between 1.2 and 2.5% of dry matter. The feline kidney's optimal phosphorus intake threshold is 0.5% or below. You are feeding your cat up to 5 times the phosphorus concentration their kidneys can safely process. Every day, in every bowl. Chronic kidney disease is now the leading cause of death in domestic cats over the age of 10. Let me put a number on that. Approximately 30 to 40% of all cats over the age of 10 are living with some degree of kidney disease right now. Not predisposed to it, not at risk, living with it, actively. This is not a genetic epidemic. Cats did not suddenly develop a biological predisposition to kidney failure over the past 70 years. The timeline matches exactly one thing: the mass adoption of dry commercial cat food beginning in the 1950s. The global cat food market generates approximately $28 billion annually. Dry kibble represents over 60% of that revenue. Royal Canin, Hill's Science Diet, Purina, and IAMS control the overwhelming majority of that market. These companies know what the 1987 Finco study found. They know what the 2006 Moisture study found. They commission their own research. They have access to every piece of published veterinary literature on the planet. They made a business decision. Volume, shelf life, and margin won. Your cat's kidneys lost. Now, here is the practical part. The $2 solution that changes everything. It is not a supplement. It is not a powder. It is not something you order online. It is moisture. Specifically, the intentional addition of high-quality wet protein sources to your cat's daily diet. Here is the exact protocol based on the clinical evidence. The primary intervention is replacing dry kibble with a combination of raw or lightly cooked animal protein and organ meat. Protein sources that naturally contain 65 to 70% moisture, low phosphorus concentration, and the amino acid profile cats require as obligate carnivores. The specific ingredient that costs under $2 per day: chicken thigh meat and chicken liver, sourced from any grocery store. Chicken thigh contains approximately 0.18% phosphorus, well within the safe feline threshold. Chicken liver contains taurine, an amino acid cats cannot synthesize independently, which is stripped entirely from dry kibble during the extrusion process at temperatures above 150 degrees Celsius. Taurine deficiency in cats causes dilated cardiomyopathy, heart failure, in addition to accelerating kidney decline. The pet food industry adds synthetic taurine back into kibble after processing. Synthetic taurine has 60% the bioavailability of naturally occurring taurine in raw tissue. $2 a day, grocery store, no subscription, no prescription, no $40 bag with a photo of a healthy cat on the front. I want to be honest with you about something that is uncomfortable for me to say. When a cat is diagnosed with chronic kidney disease in most clinics, including mine for most of my career, the standard recommendation is a prescription kidney diet. Hill's KD, Royal Canin Renal Support. These products cost between $60 and $90 per bag. They do reduce phosphorus. That part is scientifically valid. What the prescription bag does not tell you is that the same phosphorus reduction can be achieved with fresh chicken thigh and liver at 1/10 the cost. Why do veterinarians recommend the prescription bag instead? The same reason I did for years. It is what we were taught. And we were taught by an institution that received funding from the companies making the bag. A 2021 survey published in the Journal of Feline Medicine and Surgery found that fewer than 12% of veterinarians reported recommending fresh food alternatives for cats with early-stage kidney disease. Not because the evidence does not support it, because they were never taught to consider it. I am not asking you to stop seeing your veterinarian. I am asking you to ask better questions. Ask your vet, what is the phosphorus content of the food you are recommending? Ask, could a high-moisture fresh protein diet achieve the same result? Watch what happens when you ask those questions. The answer will tell you everything you need to know. Here is exactly what to do. This works for cats at any stage. Healthy cats you want to protect, and cats already diagnosed with kidney disease. For healthy cats under 8 years old, transition to a minimum 80% wet or fresh food diet immediately. Dry food can remain as 20% of the diet without significant harm if the primary diet is high moisture. For cats over 8 years old, eliminate dry food entirely. Their kidneys cannot absorb the chronic dehydration load of kibble at this stage without measurable damage. For cats already diagnosed with kidney disease, this transition is urgent, not optional. The protein ratio for kidney protective feeding: 70% muscle meat, chicken thigh, turkey thigh, rabbit. 15% organ meat, chicken liver, maximum twice per week to control vitamin A levels. 15% bone broth, homemade, no salt, no onion, no garlic. Simmered 6 to 8 hours, 1 to 2 tablespoons added to every meal. That bone broth is the single most underrated kidney intervention in feline medicine. It provides collagen, glycine, and hydration in a form the cat will consume willingly without needing to be tricked. The transition protocol, because switching overnight causes digestive rejection. Day 1 to 3, 90% current food, 10% fresh meat alongside. Day 4 to 7, 70 to 30 split. Week 2, 50-50. Week 3, 20% dry or previous food, 80% fresh. Week 4, full transition. Some cats resist immediately. Place a small amount of meat broth, chicken, no salt, on top of the fresh food to increase palatability in the first week. What you will observe within 30 days of this transition in a cat with existing kidney disease: increased water consumption drops, because they are obtaining hydration from food as their biology intended. Vomiting frequency decreases. Kibble-fed cats with kidney disease vomit regularly because their digestive system is rejecting a food format it was never designed to process. Weight stabilizes. Kidney disease cats lose muscle mass rapidly on dry food because the protein bioavailability in processed kibble is significantly lower than in fresh tissue. Within 60 to 90 days, repeat blood work will show measurably stabilized creatinine and BUN levels in most early to mid-stage kidney disease cats. I have documented this outcome across more cases than I can count in 12 years of practice. The stabilization is not a cure. Kidney disease is not reversible, but its progression is absolutely, measurably controllable. With $2 a day and a pot on your stove. 30 to 40% of cats over 10 are living with kidney disease right now. Most of them were fed exactly what their veterinarian recommended. Exactly what the bag said was complete and balanced nutrition. The bag was not lying about the nutrients. It was lying by omission, by leaving out the one variable that drives feline kidney failure more than any other: chronic, lifelong, structural dehydration. Your cat cannot tell you they are thirsty. They cannot tell you their kidneys ache. They cannot read the study from 1987 that would have changed everything. But you can. This information is not locked in a laboratory. It is in the peer-reviewed literature, in the clinical data, in the biology of an animal that evolved to never need a water bowl. It was just never shown to you. If this reached you in time, share it with one person who has a cat. Every share is one more cat that does not have to die the way Luna did. Subscribe, because what we are covering next is going to go even further than this.